Probably would not be in front of your television sets or online. You'll be enjoying a Friday evening after a long week. But since the arrival of COVID-19, our lives have changed so much. The things that we took for granted, things that we thought to be normal that we did every day have changed drastically. Stay at home, social distancing, wash your hands. So much has changed in our lives. Tonight, we're going to attempt to take a look at how these changes have affected our children. Oftentimes, as adults, we go about our own lives thinking about the things that are important to us, not realizing the impact that the things around us and the impact that we are having on our children. So tonight, I'm joined by two esteemed gentlemen who are going to be joining me for this portion of the town hall meeting to answer your questions specifically related to the health of our children and the educational pursuits of our children. Joining me, no stranger, Dr. DeLon Brennan. He's the Deputy Chief Medical Officer. Welcome.
Thank you, sir.
And the Director of Education, Mr. Marcellus Taylor. Pardon me, I'm going to call you Hall all night because that's my colleague. Pardon me, Marcellus Taylor. Gentlemen, as I started out by saying, this is such an unusual time. We have found ourselves in a unique set of circumstances, unprecedented. But we have to make the best of what we have and try to make it through this. And tonight we're focusing on our children. Oftentimes, as I've said, we go about our daily lives not thinking about how what we are doing, our actions, are affecting our kids. So let's talk, first of all, Dr. Brennan, about sort of the general health and well-being of our children. We have a hard time policing ourselves as adults. Wash your hands, social distancing, etc. Wear your mask. When you're dealing with children in a disease like this, what are some of the unique things that we need to be thinking about when it comes to our children? Things that children will do to put themselves at risk.
Yeah, thanks again for having us. I think one of the important things for us is to understand that children are not just one consistent group. It's not a homogeneous group. It goes from, people who are just born and are dependent upon you for everything, and their actions are such that everything that you do kind of comes in and affects their health, as opposed to those who run into the middle of the road where they want to express their own independence, they're doing things on their own, but they're still dependent upon you to supply some of their needs. And then we move on to those who are older, those adolescents, where they really want nothing to do with you at all, and they feel as though they can kind of do it all on their own, and they want to be as separate from you as possible. And those are sort of just the gamut, or sort of the myriad of situations that we're in. So when we talk about children, we do have to consider all of those parts of it. But when we do so, I think the thing is we realize that kids or children in general are very sort of social creatures. Whether it's social with you or social within their peer group, they want to feel connected to something. And a lot of times that does manifest in a way that they are physically within the same space as someone else. So you can't just tell them to be, I want you to be socially distant. I want you to stay away, stay 6 feet. Don't touch me, don't kiss me. You need to wear this mask the whole time. They just don't, they're not of the intellectual sort of maturity to be able to understand that at some realm, and some of them just don't care to. They understand, but they just don't want to. And so they want to be in your face, they want to be around you all the time. And so one of the things that we have to do is figure out how do we begin to put ourselves in a safe space to be able to do that. And so that really requires a lot of action on behalf of the adults in the situation to be able to protect our own children. So one of the things that we tell adults throughout this COVID-19 is if you don't do it for yourself, do it for your children or do it for your dependents. So if you're not going to socially distance and not go out and joyride and not go out to a store where you don't really need to just pick up that random item, don't just show up at those instances. If you want to do it for yourself, that's understandable. But if you have children who are now dependent upon you, whatever you do, you are bringing all of that home to them as well. And while your immune system and you are able to fight it off, their immune systems are not the same. And if you don't protect them, we're going to put them in a stead where they begin to suffer. They suffer from the disease. And it really is dependent upon what we have done as adults. And we haven't done all that we need to protect them. So we have to consider that in those situations.
In the very beginning of this disease, even before it got to the stage of being a global pandemic, we were told the most vulnerable amongst us are the more likely to be hit the hardest. The elderly, those with with conditions. I've learned the term, we use it so freely now, comorbidities.
Yes.
We didn't know what that was almost before this, before all of this happened. People with pre-existing conditions, non-communicable diseases. But I think first of all, when the first child was diagnosed, I think it gave us pause. And then 2 more children have now been added to that list. Did that change the dynamics for you all at the ministry? Did it cause you now to have a different focus? I'm curious as to sort of what the reaction was when we got to 3 positives within children.
It definitely let us know that we needed to think beyond just what was happening in our adult and our older or elderly population. We knew that we couldn't just focus on that grouping. Now, it is still true that children are less affected when it comes to the severe cases of the disease. So you don't see necessarily as many children being hospitalized or having to go to an intensive care unit requiring ventilatory support. We're not seeing as much of that as possible, as could happen or as does happen in our elderly population. And you're usually looking at kids and elderly people about the same when it comes to a lot of these infectious diseases. But what it does tell us is, and this is sort of my approach when it comes to delivering pediatric care, is a lot of times what happens to kids really isn't their fault. A lot of times we as adults haven't put in the right safety measures, or we're doing things, we speed in a car and they're not in their car seat, or things of that sort, and we set them up for failure to go along with it. So we know that none of those kids was the primary in the infectious disease coming to their doorstep. What happened is there were a set of adults that were out doing their own thing, and they eventually brought it home, and those adults then passed it on to the children, and the children then ended up being ill from the disease. Now, majority of them have very mild disease or are asymptomatic altogether, so they're walking around, they're very happy. But the problem is, we know that we need to change our focus, because it isn't just about that individual child, it is about all of the children that they may come into contact with. So they have peers as well. So we had to make sure that people weren't going into play groups and spreading it to each other. They weren't inviting each other over for additional activities and then spreading it. Teaching our children about respiratory etiquette. Before, it was great to tell them, use a tissue or use a hand towel, things like that. But changing that practice to saying cough into your sleeve or sneeze into your sleeve, that's a different mindset, and we needed to change that. Not just with our adult population, but that needed to be translated into what we tell our children to do as well. And when they start to see those changes from not just the etiquette when it comes to health, but also, they're not in school anymore and they're not able to be around their friends, it is a very different landscape for them. And we as adults need to continue to, and we as in these governmental agencies need to make sure that the adults in our community are prepared to address the fullness of what our kids need to do and what they want to do. It's not just about food and not just about making sure that they take their medicines. Their health is much more and fully encompassed of just their physical health, their mental health, their emotional stability. All of that has to come into play, and we need to address that more fulsome.
We of course will be speaking about the sort of the psychological and emotional effects a little later on in the program. Our Director of Education, Marcellus Taylor, is here. Marcellus, it's been a couple of weeks, maybe about 2 weeks or so, since the Bahamas Learning Channel was launched, and since we've started this virtual learning center. Let's put that into perspective and talk about how that's been going so far.
Well, actually, we started the virtual learning platform on the 23rd of March. So we've actually been going for about 5 or 6 weeks. When we started out, of course, the numbers of persons enrolled was relatively low compared to what we have as our overall enrollment. We had about 11,000 students when we started. But now, as week by week has transpired, we have more and more students, and I think now we have about 41,000 or so students registered. On a daily basis, 16, 17,000 students go on. And so people even ask about that disparity in numbers. But some of it is that students could go on at any time. And so they don't have to always go on every day. Also, what we know is that there are many other things going on. So you have some parents who have enrolled their children in some off-the-shelf programs from the U.S., homeschooling programs and so on. You have a lot of teachers that have actually started their own lessons and their own Zoom communications with students, or communicating by other means, WhatsApp and all these other social platforms. So we're confident that a lot of students are engaged in learning. It may not be the same number of hours that they would have done if they were, locked away in a school. And we see this as school being open. So we expect students and the parents, of course, to ensure that the students are participating, if not daily, certainly with a high degree of frequency, because every day is a day that they could maximize. And since they're home doing relatively nothing in any event, why not maximize the learning opportunities that are there?
How will you bring that all together? I mean, you speak about the 41,000, I think, that are registered in the virtual learning center, and great numbers. But when you look at who's engaged, who's not, who may be learning from other means, who may be interacting with teachers, is there a way to pull all that together to ensure that all kids are receiving the same level of education, I guess is what I'm getting at?
Well, I'm not so sure about the same level, but what we want to do is we want to actually introduce a stronger learning management platform.
Okay.
So that every time a student logs on, we know how much time they've spent on, which subjects they've gone to look at, and their teacher can use that to support them in ensuring that, well, I noticed that you didn't go to your math class. Why didn't you go to your math class? Mm-hmm. Okay, you need to make sure you make it in your math. Right. And so we are shortly going to have a new platform that is going to roll out that will give us the ability to do that. As for the other things that are going on, we're in the process of collecting that information. But as we build this platform, we hope to fold all of those other activities into what we're doing on the centralized platform, so that we could be able to account and also make sure that we're supporting the children in the best ways that we can.
We've got to take a quick break, but I want you to think about, when we come back, sort of how we can engage. I want you to talk about how you're engaging the parents a little bit more as well, because parents obviously are the key to all of this and ensuring the kids are getting that education. Stay with us. If you have just tuned in this wonderful Friday evening, we are here at the Bahamas Ministry of Health's virtual town hall. We're looking at how COVID-19 is affecting our children and what we can do to put them in a better position to come out on top on all of this. Stay with us. We're going to be back right after this.
Hi, my name is Callie, and I am 5 years old. Today I'm going to tell you a little bit about the coronavirus. The coronavirus is a little tiny invader that gets into your body and makes you really, really sick. Some people get over it, some people don't. This virus is so tricky. It makes you think you have the flu. So you may experience a high fever, difficulty breathing, and tiredness. But don't worry. Here are some steps to protect you from the coronavirus. Step 1. Wash your hands with soap and water for at least 20 seconds. If you don't have soap and water, use hand sanitizer. Step 2. If you need to cough or sneeze, do it in your elbow. Achoo! Step 3. Avoid touching your eyes, your nose, and your mouth. Step 4. Eat healthy foods to make you big and strong. Step 5. Listen to your mommies and daddies to keep you safe from the coronavirus. Bye. Be safe. Stay inside.
This public service announcement was brought to you by the Ministry of Health and Bahamas Information Services.
And welcome back to our virtual town hall meeting presented by the Ministry of Health. Tonight our focus is on our children. 502-7382 is the number to call in with your questions tonight. We are taking questions from those of you in the audience. Some of them have been sent in prior to tonight's show, so I'm not just making up all the questions as they go along. We've been asking people to submit. Our Director of Education, Marcellus Taylor, is here along with the Deputy Chief Medical Officer, Dr. Delon Brennan. Director, as we went into the break, I sort of raised the question, what is the role parents should be playing? A lot of times we are distracted with the things of our own lives, but we are the stewards of our children. What should our parents be doing to ensure that our kids are continuing with their education?
Well, you know, the role of parents is actually critical at this point in time. It's even more critical than when we are in school in the four walls, because the whole issue of duty of care and the classroom discipline and so forth that teachers provide ordinarily, that provides the structure and that supports the students in terms of their focus and participating in school, is that element is now gone. And that is now resident at the level of the household. And so what we have sought to do is we have sought to provide some tips and some videos on our website so that parents could go on there and have a sense of what it is that they could and should do. But, you know, some parents require no support at all. These parents already have their children in structured lives. They have them on schedules. They do all sorts of things with them. The greater problem is parents who either don't have the wherewithal or the struggles of life are so overwhelming for them ordinarily that they now have the difficulty now to add this new task on, which is not just to provide the food, not just to give them the uniform, but to now sit down with them or to actually ensure that their children are doing the schoolwork, and it's very difficult. And so what most of our teachers are prepared to do is to give the parents the support that they can. But, you know, we only could do so much. And what I'd like to say tonight and really make a plea to parents is that you have to realize that in this time, you have to take on a greater responsibility. We could offer you the support, we could provide the instruction, we could do all those things, but we cannot make your children do the work. We cannot be there to ensure that at 11 o'clock when their science class comes on that they're there. That is something that you would have to do.
It's not the ministry's responsibility either. This question has come in. Can education give a definite answer on when schools will reopen and if national exams will be cancelled?
Okay, so we can't give definite answers on that. The definite answer is this. The Prime Minister on Monday of this week, I believe it was, presented in Parliament a graphic that indicated that there are 5 phases to the rollout of certain things. Phase 5 is the phase when it has been said that schools will be allowed to open, I guess, more or less fully. But phase 3 is the phase when it has been delineated that special educational events could take place, such as national exams. So definitively, when phase 3 comes, we would be in a position to deal with national exams. When phase 5 comes, we'd be able to open up schools again. Now, when exactly phase 3 will come,
right.
This is all up to
so it's
the
not the
country's response.
date, it's the phase that we need to look out for.
Yes, right.
Okay, another question too I'm going to get in with education. If exams proceed, how will the Ministry of Education guarantee a fair assessment for all students who participate in the exams, given that many did not or may not have had the opportunity to engage in this platform?
Well, what we believe is that the examinations, BJC, BGCSE, a 3-year program. Let's just be clear on that. It's a 3-year program. So when we look at the number of days that students are supposed to be engaged in study for the BGCSE, and when we look at the number of days that they did have to engage in it, we see that in most instances, 95% of the time, they were in school. As you would know from your school days, after Easter break, you basically only doing revision in any event.
Yes, yeah.
And so we are confident that most students would have done virtually the whole curriculum by this point. What we impress upon students at this time is to utilize this time to refresh yourself and to revise all your work. And even if you're not on the platform, even if you can't get on the virtual platform, you have your textbooks, you have your exercise books for 2 years and 2 2/3 years worth of schooling that will be the core of what you're going to be tested on. So you really, it's up to you. You really have the opportunity to prepare yourselves.
So it's really just looking at the material. What about those other students in those other grades?
Well, the students in other grades have to continue to prepare. Why? Because all of these exams are cyclical. They're not just it's not just the content from grade 12 that you follow in. If you're in grade 10, what you're missing now will come back to haunt you in grade 12 if you don't participate. So if people are worried about exams, remember that any content not taken now puts you at a deficit going forward. And so we encourage everybody to participate. But even above that, above exams, right? No one is going to say when you're 28 or 29 years old, oh yes, you don't know this bit of content because you were one of the children in COVID and this is why you don't know it. Mm-hmm. You have to prepare yourself for life. Yeah, yeah. And this is what education is all about.
Very, very important point. And Dr. Brennan, we're going to swing back over now to the medical side of things. And this question says, children can't always express their symptoms clearly when they're sick, or sometimes they don't act how a sick child should typically act. What signs can parents look out for to determine if their child is sick with COVID-19 if they cannot express themselves clearly?
I think this is something that we run into from the pediatric side of things fairly often. And so when we have kids that are ill with any issue, a lot of times they just can't express themselves. And so parents, guardians, grandparents, aunts, uncles, they all form the core of what it is to give us the information. And a lot of it is just how different is the child now versus when you see them and interact with them on a normal basis. Are they sleeping more now than they usually do? Are they fussier now than they usually are? Are they eating as much as they usually do? Do they seem as though they will interact with you less than they usually do? All of those are signs that even though you can't say, this child specifically has belly pain, or they have a headache, or they have neck pain going on, that information that you give us is critical for us being able to direct what our assessment needs to be from a history and physical exam point for that individual child. And a lot of times, even though we say this, physically their vital signs look okay, and our exam says that in general they're okay. If you see a mother, a father, a guardian walk in and say, this is just not my child, this child is different from what they usually look like, in a time like this, we have to take that very seriously, and we know, the things that are going around in our community right now include COVID-19. Is this a child that I need to suspect is having those issues? And what we've seen is from lots of different medical agencies, but specifically we'll actually refer to the US CDC. And so they have added another level of symptoms to their original definition of COVID-19. So originally it was fever, difficulty breathing, shortness of breath, those were the cough. Those are the things that we were really focused upon, purely respiratory and fever kind of stuff. But when we look at the science that has happened and just watching not just children but adults over the course of the past 4 months, we see there are other symptoms that we need to worry about as well. So fatigue is a big one that's happening as well. The vomiting and diarrhea are happening as well. There are people who are presenting with first-time seizures, with headaches to go along with it. So it isn't that we could purely rely on the respiratory side of things. We have to look out for those things as well. So someone may come in and say, my child just has fever and they've been having, vomiting to go along with it. We can't just blow that off anymore. We have to say, you know what? There are some people who present with COVID who have just these symptoms, and we have to have a higher index of suspicion in that instance. And so we who take care of children on the medical side of things, we definitely have to pay attention to even those subtle things. And if someone tells you their child is not the same, we have to then take back and say, you know what, let me figure out what else could be going on with this child.
Mm-hmm. Director Taylor, will summer school or summer programs be recommended for students and teachers to participate in?
Highly unlikely.
Why not?
Why not? Because even right now, we have a lot of teachers, district superintendents, school administrators, curriculum officers, subject secretaries, who are working, I mean, pretty much round the clock to do what we have done. Our staff, a lot of them are very caring, and they put a lot of energy and effort into trying to support the students at this point in time. Sometimes I feel a little bit like a slave driver because we're still pushing them beyond. But they're doing it because they care for the students. They're doing it because they want to give the students opportunities. So, you know, I mean, when we get further down into the summer, people are going to need a break.
Another question here that's come in. Ministry of Education and by extension Social Services engages external food vendors to provide lunch for many students. What process and requirements will these vendors have to maintain?
Well, as it stands now, all of our caterers, lunch caterers and vendors, they have to go through, you know, certification, food handler certification, I think it's called. We also have some inspections that are done periodically on them. I'm sure that that process would be enhanced and strengthened by the Ministry of Health. And so whatever new standards are put in place, we will ensure that those persons who serve food will have to meet those standards, and we will increase our monitoring of them to ensure that they comply.
Director, you're about to leave us. Any parting words you want to give to parents or even some kids who may be watching tonight? Anything the ministry really wants to stress to kids during this period?
Yes, to students and parents, we'd like to say to you that we are doing the best to provide you with what we believe is a good alternative to face-to-face instruction. We believe you should maximize that opportunity. And to the extent that you need any support, there are teachers and others who are willing to offer that. So please make sure that you engage in active learning and that you get support if you need it. Also, I would just like again to thank all the many colleagues, the ones I listed above and maybe some others who I didn't have a chance to list, who have done the other thing. You know, some people in the face of a crisis, they're paralyzed and they don't want to take action, and they resist and they bring up all sort of red herrings. But then the true patriots are the ones who look it dead in the eye and say, we have to do what we have to do to move the country forward. And so I'd like to thank all of those persons in education who've done that.
Director, thank you very much. We encourage you to continue the yeoman's task. I mean, I can't imagine having to do what the ministry is doing under these conditions. So we wish you the best, and congratulations thus far on what you've been able to achieve. It certainly is a great accomplishment. Dr. Brennan, you're going to stay with us for the other half. Stay with us, folks. Our virtual town hall continues right after this.
Self-isolation means taking simple steps to avoid close contact with other people as much as possible, as you would with the seasonal flu. If you have been in close contact with somebody confirmed with COVID-19 or suspect that you have it, self-isolate for 14 days. You can self-isolate by staying indoors and away from family for 14 days. Choose a well-ventilated room with a closed door. Household members should stay in a different room, or if that is not possible, maintain a distance of at least 3 feet. Use a sealed waste basket and double bag your waste before disposal. Limit movement in your house. Stay in your assigned space away from the rest of the household. The caretaker will bring food and anything else you need. Use separate cookery and cutlery. Use a separate bathroom and clean it regularly. Use separate towels, separate cleaning linens, and clothing. If you are in need of care by household members, limit the number of caregivers. Assign one person who is in good health and has minimum risk conditions. Most importantly, remember, do not invite others over. Should you or anyone you know feel that you've been exposed to the coronavirus, contact the COVID-19 hotline at the Ministry of Health immediately. To reach us, call 376-9350, 376-9387, 300-2619, or our 24-hour hotline at 502-7382. For more information, visit covid19.gov.bs.
This public service announcement was brought to you by the Ministry of Health and this television station.
If by chance you are just tuning in, you are watching the Ministry of Health's live virtual town hall. Tonight we're talking about the impact of COVID-19 on our children. A number to call with your questions, 502-7382. Let me repeat that, 502-7382. Be sure and give us a call with your questions. We have been receiving some, so we do have the questions that have come in thus far. I'm happy to be joined in this segment by Dr. Novia Cardalucci. She's the chair of the National Child Protection Council and director of the Bahamas National Drug Council. Welcome.
Welcome, sir. Thank you.
We have a lot to talk about. Deputy Chief Medical Officer Dr. DeLon Brennan is still with us. I'm going to dive right in, Dr. Cardalucci, and get people to understand, or try and get people to understand what it must be like for a child in this period. Suddenly, everything that you know in life has changed. There's no going to school. There's no going to the playground. There's no interacting with friends. Can't leave the house outside of probably the yard. Your world has changed, and it probably doesn't make a lot of sense. What's happening with our children right now, psychologically, mentally?
For a lot of the children that exist within the Commonwealth of the Bahamas and worldwide, this is a new era. It's a new era in that God has silenced the world, and now everything that we know to be normal has shifted and changed. Let's look at it for a minute. The mere fact that children are not able to go to school shows a paradigm shift. The mere fact that children aren't able to go to the playground, they're not able to do their extracurricular activities, all of that indicates that it's a new world order for a lot of our kids, and for a lot of them, it's confusion. Let's look at it also from another perspective as well. One of the major challenges facing our children as well is watching the reactions of their parents. Let's look at what's happening in the lives of parents for a minute. You have some parents who don't know what the future is like, don't know where food is coming from, have lost their jobs, don't know if they're going to return to jobs. But guess what as well? A lot of parents now have to exist within the virtual world. And so parents now have to learn all about Zooming. They have to learn how are their children going to manage in a virtual school. And so for a lot of parents, they feel stressed. They sit down and watch CNN and all the other news broadcasts, and now they themselves are wondering, what's the future like? And so the children now, piggybacking off of their parents, now they're saying as well, what does the future hold?
How do you mitigate against that? I mean, the reality is we don't know. The reality is many of us are out of jobs and are stressed. What do you do?
I think for me, I look at it as an exciting time. When we look at the world crisis, the word crisis itself, a lot of persons take that word to be a negative connotation. However, the word crisis in and of itself indicates also opportunities for growth. The Bahamas has always been a resilient nation, and for us now, it's time for us to pull up our bootstraps and plot the way forward. Let me give you some examples. This is an awesome opportunity now that God has quieted the world. Now we have time now to grow as families. Let's think about it. The families of today are completely different from the Bahamas we knew 30, 40 years ago. And so now this is our opportunity to grow as families. Let's look at it. During this time, now we have time to go back to the Bible. We could have Bible studies within our homes. Not only that, now it's the opportunity for mothers to teach their daughters how to bake bread. And they better teach their sons too. But anyway, now we could go back to Coconut Jimmy. We could go back to those things that are traditionally Bahamian because we have the time. Look at it. More people are on the road going for walks now. More people are taking the time to be in their homes to play board games. And so now is the opportunities for families to grow. And so that's an exciting time for us as a nation.
You know, that's a really good point. I can't even tell you the disasters I've had trying to bake myself. But, yeah, and you do it to pass the time, so it's a very good point. We'll come back to you in just a minute. Dr. Brennan, this is a question that comes in. What are the top 3 ways to protect your child or children from illnesses during this time?
So I think if we talk about a number of ways, 3 may be sort of, even limiting the number of things we can do.
Sure.
But I think as much as possible, we want to make sure that we minimize their exposures to the illness itself. And so while we always encourage our children to, have friends and interact with other people so that they can kind of grow their sphere of influence, they kind of know, what personality types are out there. This just isn't the time for that, because the more people they come into contact with, the more their opportunity to become infected is. So this is one of those times where we want to make sure we minimize their contacts with people outside of the house itself. At the same time, we want to make sure we teach them about what kinds of hygiene mechanisms are going to protect them as well. So when we talk about washing of hands, this is a procedure. And just thinking about, our own kids, our youngest son and, my daughter, they love just finding a way to make things fun. So just talking about how to wash hands and singing songs while you're washing your hands and being able to do it for themselves and
Children
being
love
able
to
to
play
do
in
it
water
together.
as well.
They love this part of it. And the thing is, we see it as a chore for us to be able to wash our hands for 20 to 30 seconds. For them, it's a game. It's an enjoyable part of it. So I think these are the kinds of times where we make it a little bit more fun and enjoyable for them to be able to just do the things that are going to keep them healthy. When we talk about coughing and cough etiquette to go along with it, we need to teach our children how is that different. For kids that are coughing out into the open or are used to coughing into their hand, we teach them how do you do it into your elbow. You make a dance out of it. You make, an exciting thing. People talk about, and this may be even old at this point, but you talk about the whole dab to go along with it, right? And so if you teach kids to dab while they're doing it, it makes it exciting for them because it's new, it's different. And then it becomes part of the routine, and they're not even thinking about it as this is hygiene and it's restrictive. This is a part of what I need to do. Being able to put all of those things together in a way that they understand and makes it fun for them is a very different approach than making it punitive. Even we as adults don't like to be punished or have a stick put over us to say you have to do this. But if you put it as a carrot and you make it exciting and something we want to do, I think that's the way to change the paradigm from, you have to do this to now I want to do it.
Yeah, great. 502-7382 is the number to call in. We have a question coming here. Dr. Cartalucci, I think this is for you. What can parents do to help stimulate their kids and care for their mental health during this time when they can't play outside or play with other children?
Like I said, this provides us an excellent opportunity now for us to look at new ways to do things, new ways to develop our families, and new ways in which to develop our children. One of the things that's really big for me is kids as entrepreneurs. We've seen how the tourism industry has been our sole focus. Now is our time to look at the younger generation and let's see how we can inspire the younger babies to become involved in business opportunities. So I like to push even in terms of agriculture, in terms of letting them look at pottery making, and in terms of looking at candles, fishing. So now is a prime opportunity for us to look at ways to diversify our economy, starting with the little babies. Let's get the little babies interested in thinking how you're going to take care of yourself later in life.
Another question for you. This caller wants to know, how do you suggest families prioritize?
That's really interesting that you asked this question. And I thought about it when the Director of Education was speaking, because a lot of parents now truly value the role of an educator because they probably had no real idea what does it take to be a teacher. Now a lot of parents have to walk into that role a little bit. They got some of the feel of what it's like.
They're very stressed.
I know, but that's good because now when we have Teachers Appreciation Day, teachers are going to get some awesome gifts.
Big baskets.
But I want you to think about this aspect of it. I don't want, because of COVID-19 and our stay-at-home orders, for parents to feel the new world order is that I need to set up a strict regimen and I'm going to make sure the kid does 10 hours and da-da-da-da-da, because you don't want the kid to then, I hate school. You want it to be, because one of the most wonderful learning opportunities we have, or I almost say we have as educators have, is the fact that once we have parents as partners, then a whole lot more could happen with education. And so the biggest thing is for parents to realize, partner with education, create new routines, but always keep at the forefront the well-being of the kid is paramount.
Great advice. 502-7382 is the number to keep those questions coming in. We're going to take a break. We have a lot more questions to get to right after this. You're watching our virtual town hall meeting right here on a wonderful Friday. What else do you have to do? Stay with us.
And I am 5 years old. Today I'm going to tell you a little bit about the coronavirus. The coronavirus is a little tiny invader that gets into your body and makes you really, really sick. Some people get over it, some people don't. This virus is so tricky, it makes you think you have the flu. So you may experience a high fever, difficulty breathing, and tiredness. But don't worry. Here are some steps to protect you from the coronavirus. Step 1. Wash your hands with soap and water for at least 20 seconds. If you don't have soap and water, use hand sanitizer. Step 2. If you need to cough or sneeze, do it in your elbow. Achoo! Step 3. Avoid touching your eyes, your nose, and your mouth. Step 4. Eat healthy foods to make you big and strong. Step 5. Listen to your mommies and daddies to keep you safe from the coronavirus. Bye. Be safe. Stay inside.
This public service announcement was brought to you by the Ministry of Health and Bahamas Information Services.
Welcome back to the Ministry of Health's virtual town hall meeting. In this final segment, we're going to take a couple more questions that have been coming in. One, Dr. Brennan, has to do with kids who have pre-existing conditions. Given the restrictions of movement, how can a parent who has a child with a non-communicable disease ensure that their child adheres to their diet and medicine schedule?
I think the important thing is for us to make sure that we stay connected to our healthcare providers and those who can help us out along with it. Our healthcare providers are no longer in a space where they can just rely on patients coming into their office and be able to advise them from there. So a lot of them have launched into these same sort of virtual platforms where they now are connecting to people on whatever app or, electronic means that they're using in order to connect with their patients. And so this is the perfect time for you to have a sort of a three-way conversation in between the patient who's the child, and you want to make sure you empower them so that they can speak about how they feel about their own illness and what's affecting them. Use the parent or guardian as well, and then the healthcare provider. And once you involve everybody in that three-way conversation, that's kind of the best way to empower them as they go through. You teach them how to do it. You let them know that they are in charge of their own care. And then we're just here to help support you along the way. And so if you feel like I don't want to take it with orange juice, but I want to take it with water or milk or apple juice, well, let's figure out a way to make that a way that you feel like you're in charge of how you do it and how you take that. And we can move ahead with getting your medicines in, getting your schedule in, and kids love nothing more in this they grew up with this technology. So the fact that they don't have to get in the car and travel to their doctor, but their doctor comes to them over the same way they connect with their friends, their other classmates, makes it real for them and makes them feel as though they're in charge of how these interactions are happening. So I'd say we engage the technology.
Dr. Carter-Loki, this question has to do with intimacy. A lot of adults, parents are in the home, children are nearby, you're confined. How do you balance that need for intimacy with still having to interact with your children sometimes in such close quarters?
I think what that calls to is to also look at how some kids during this time, the stay-at-home orders, also results in a lot of kids being abused as well. Because now with the intimacy level being even a lot more tighter, you're going to have a lot more kids who are exposed to parents who may have mental issues. You may have children who are now exposed to a lot more domestic violence or child sexual abuse. And you may also have children who may now witness a lot of substance abuse in the home. And so it's going to be important for that parent who is not involved in any of those negative behaviors to almost find a way as, how do I still safeguard my child during these kind of incidents? And so that is a very major challenge that we have, being in close proximity during this order.
If you are a guardian, a member of the extended family, and you know that child is at risk in that home, or there is evidence, Should you do something to extract that child if you could?
Well, the biggest thing that you could do at that point in time was contact the Department of Social Services and make that call so that the department could either send a social worker in to investigate and, if needs be, to remove the child. But always, our hope is always to make sure that we keep families intact and we strengthen families so that the children could remain in that environment. But if the environment is harmful to the child, then the department will take the necessary steps.
Dr. Brennan, this question has to do with vaccines. With all the theories and views about vaccines, how can a parent feel confident that they are acting in the best interest of their child when they get them vaccinated?
What we do know is vaccines are the #1 public health intervention over the past 100, maybe even 200 years that have allowed us to minimize the number of deaths, especially when it comes to children across the world, during this time period. Second to that is probably hygiene, right? So being able to wash our hands and have, good water and sewage systems and keep, clean water coming to houses is still second to vaccines in the amount of illness and death that we've been able to prevent. The science is there. Real numbers, real science still exists for us to be able to get to parents and guardians to let them know that vaccines work, they keep people healthy, and we want to make sure that you get the right information. All of the scientific information sometimes falls victim to that one celebrity who comes on and says, well, I read or I heard about this, or my child had an issue, or I believe, and then all of the work that you've done over the many decades to centuries at this point when it comes to vaccines can be unraveled and undone in an instant. And what we want parents to believe is you are smarter than that. You know more than that. And if you want to research for yourself, look at both sides of the argument and look at the totality of the information that's out there. When you do, also have a conversation with someone you trust in the medical field as well. Let them start to speak to you about how vaccines can help. What we are starting to do now that this pandemic and the outbreak that's happening in the Bahamas has now taken us into weeks and now months is realize that persons are afraid to come into our healthcare settings to be able to get their vaccines and to be able to, just have regular doctor visits. So now we are stretching and moving beyond the four walls of our healthcare institutions, and we're going into communities. We want people to know that we are now coming into your own communities to be able to have those conversations and deliver those services as well. So we'll be making announcements over the next few weeks to say, we're coming to this church, we're coming to this social area, we're coming under this tent, and we're going to be able to deliver those services to you where you don't feel unsafe bringing your child into a healthcare institution where they may be exposed, but we're going to put you in a protective area where you can socially distance, get those vaccines delivered to you to protect you not just during this outbreak and this pandemic, but over the long course of your child's lifetime, so they too can feel comfortable that it isn't just about surviving this one illness. There are many vaccine preventable diseases that we need to make sure our children, when later exposed, are protected against as well.
Lots of things out there. Dr. Carloki, this is for you. What are some of the ways that parents can ensure their children are safe while online? Kids are spending a lot of time online now. They're living in a virtual world. How do you safeguard your kids at a time like this?
One of the major steps that we've taken with the National Child Protection Council is to do a lot of training with parents and children to ensure their safety while online. The biggest thing is, and the challenge now, because remember 20 years ago when we said this, it was easy to say, make sure that you have those equipments inside the living room area, a common space. But the truth of the matter is, with our telephones, with the tablets and all that stuff, these kids are online in their bedrooms, and that's scary. And so the biggest thing at night as well. And so the thing that we now tell parents is 5 basic things. You have to have that conversation with your child where you talk about keeping kids safe. One of the #1 records that we use is we tell parents simply cut off the modems at a certain time at night. For example, within my home, I have only Apple devices for my kids. So they be using their devices, and then you'll see them 12, 1 o'clock. Mommy, cable Bahamas off or something like that. And I just roll with that.
No, it ain't
I just keep that going. So Apple gives you the ability to just shut off services. Apple gives you the ability to see what sites those children are visiting. It may cost a little bit more, but the protection that it gives parents is priceless.
And as a parent, you need to be savvy to know what your kids are doing. This, Dr. Brennan, is for you. Do home remedies like fever grass, tea, and warm in environments really keep Are kids healthy and prevent COVID, or is this a myth?
I think it can only supplement what you do as long as you do the baseline public health protective measures as well. So what I don't want you to do is say, I'm not going to wash my hands, I'm not going to cough into my sleeve.
I could drink fever grass
right,
tea.
and I'm just going to instead drink fever grass tea
Cereca.
or Cereca, right? So what we're saying is we've definitely seen benefits to using these complementary and alternative medicines to supplement what you're doing from a traditional standpoint as well. And many of us never thought that we would be going back to just the basic things that we're asking people to do. Just don't cough on each other, right? Don't sneeze on the
good
person
manners.
next to you, right?
Yeah.
You know, when you're sick, stay home. Just the basic things are the things that are going to prevent you from COVID-19. Now, if you want to supplement that by drinking a little bit of lemon tea, fever grass tea, you know, whatever it is, we're okay with that. What I don't want you to do is then stop all those other things and then promote it as a cure as you go through either. Because what we also find is people say, I'm not going to do this. I will take this medicine and I'll tell all these other people, stop whatever else you're doing and only take this medicine, because now you're putting other people at risk. You know, when it comes to our children, we need to be smart about what we put into their systems as well. And sometimes you just have to balance, you know, a little bit of that, but just don't go around telling other people, don't do these other things. Give your children gallons of this and they'll be cured. Because honestly, now you're going from, you know, maybe we'll be okay with supplementing to now putting other people at risk.
If my grandmother was alive, I would have been swamped in Cereca right about now. Dr. Carla Loki, this is for you. If a child suffers from child abuse, can they receive help at this time? Who do we report abuse to for medical attention and counseling?
All right, of course, we have a protocol that's very tight. And in that protocol, once CDU is informed, CDU would then notify the scan unit, and the scan unit simultaneously will notify the Department of Social Services. And after that is done, then the child will be seen at the Princess Margaret Hospital even during this time. And then after that, the referral will be made to the Bahamas Crisis Center. Now, because of the way, you know, because of social distancing and all that, the Bahamas Crisis Center will then make contact through the use of telephone services, Zoom meetings, and that kind of stuff at this time. So we're still providing services to kids in need, even through COVID-19.
Now, this is a question that goes to both of you. What do you think the long-term effects of a post-COVID society will be on our children in light of the physical contacts and changes in social interaction?
I think if I was to take this on, I think it presents us with an opportunity for growth.
Yes.
I think many of us, you know, we think about what are the harmful effects that go along with it, but a lot of our kids haven't gone through, you know, trying times and trials to go along with it, haven't built up the resilience to go along with, you know, not being able to find food, not being able to have access to all the things that they're so used to having. I think this builds up resilience to let them know you can also survive in the days where you can't get in contact with your friends, when you're not really sure that you'll be able to go to the food store and get that one type of cereal that you only eat. You'll figure out a way to eat something else at the same time. And it builds them at a point where they can survive other types of challenges that will come through their world. We're not saying they need to suffer, but what we're saying is every now and again, it's that pressure that builds diamonds to go with it. And as you see your world changing around you, you will figure out how to be stronger, be more resilient, and figure your way how to navigate through the world. And sometimes we just wish our kids could have, you know, understood that the world isn't always going to be your oyster. As much as we as parents want to protect them from the challenges that come with the world, every now and again you have to trip and bruise your knee to realize, don't just run freely, look down, and you won't be able to trip over that same thing the next time you pass by the same place.
And Dr. Carla
I think,
Loki.
hold on, Jerome, I think what Doc brought out just now made me think about it as an emotional piggy bank. Once we get parents to understand, I have to make deposits into my child's emotional piggy bank every day. And so I have to say, I love you. I have to tell the child, you know, things are going to be all right. I have to push my child and say, you know what, education is important. Yeah, you're not going to school every day, but we still got to do this, baby. So once we continually deposit into that emotional piggy bank, even when something bad happens, the child still knows, my parents are here for me. My parents got me, and everything is going to be okay.
This question, Dr. Brandon, is for you. What comfort could be given to parents who will be sending their children to school without a vaccine?
I think the thing is we realize that we often in our society are sending our kids into harsh environments at times, regardless of what's going on. So it's not like we have a vaccine against the common cold. And we realize just going to school that they're going to run into other children with the common cold, and we want to protect them as much as we can, but we're putting them in that environment because we know there's so many other benefits outside of that one risk. The same thing is going to come into our consciousness and into play when we start going back into our school environments, but our church environments and the whole things we're advocating for, going out to dine at restaurants. Are we going to say, I'm never going to dine at a restaurant again until there's a vaccine for COVID-19? I think most of us are pushing to say we just want to go be able to do it. And we have to take that same sort of resilient approach with our children and say, I'm going to send you back into this environment, but I'm going to send you with the tools to survive at the same time.
New toolbox.
Exactly. And so
toolbox.
now that I've thrown a few more tools into your box, wash your hands. I'm going to send you with hand sanitizer to go along with it. I'm going to tell you when you go to the bathroom, this is how long you need to spend there and wash your hands when you do it. When you see someone else who's sick, either let them know or let the teacher know that this person's ill, so they shouldn't continue to be in school, and then we take it upon ourselves to not make it punitive, that we have a learning platform so even if you're out, you're not punished, you can still learn at the same time. So I think we're gonna build in a society where we're not saying that the only way you could be doing your schoolwork or the only way you could be working is if I see you physically and you're here from 8 to 4 or 9 to 5. We're gonna build in, I want you to get the work done. And if you're able to do that in a shorter period of time, but you can produce results, I'm good with that. And our children are going to be built in that same way, that they don't feel as though I'm just here to, check the box or click the ticket to say I was here on time and I left on time. No, it's more about building a society where it's the work that matters, and were we able to do that? And some people will take longer, some people will take shorter, but it's that work that matters.
I've kind of asked this as we prepare to wrap up, but how important is having the right attitude around your kids?
Attitude is everything. Attitude is everything, because our kids springboard off of us. So if as a parent you're walking around the house moping, if you're so depressed that you start drinking, the children learn that this is a coping mechanism, this is acceptable behavior, this is how we do it. If you have the attitude, baby, we can get through this together. As a family, we're gonna pull through it. This is an opportunity, like you said, for growth. Then everything will be fine. So as parents, we have to portray the right attitude. We have to value education. We have to value the authority of the land that says social distancing. We have to value the healthcare system to say if they are saying that these perimeters need to be put in place. So parents' attitude is going to be paramount to us managing COVID-19 and any other thing that comes forward.
That's a great way for us to wrap up this evening. I do want to thank you, Dr. Carter-Loki, for being here tonight, sharing with us. Dr. Brennan, as always, great information. I'd also like to thank Director Marcellus Taylor, who was with us earlier. This is some very good information. As we started the show, I just want to remind folks that a lot of times we get so caught up in our lives, we don't think about our children. We provide for them, we do things for them, but we don't think about how our behavior is affecting them. And we don't oftentimes take time out to realize that they're their own individuals and they need their own attention and specific things. And so thank you for coming on this evening. I learned a lot, I have to tell you. I certainly enjoyed my time with you all this evening who've joined in. Thank you so much as always for joining us. Remember to keep safe, keep your safe distance, your social distancing. Adhere to all of the rules and things that are in place. You've heard it 100 times before. None of it has changed. Folks, let's keep safe. We're going to get through this together. So once again, thank you for joining us. Enjoy the rest of your weekend.